Hello, my name is Lennart Hardell. I'm a medical oncologist. I worked for some decades in Sweden and also done research on different cancer causing agents like the Roundup stuff that was used in Sweden, but also persistent organic pollutants like PCBs and dioxins. I'm now working on very much on the radio frequency radiation that we have in the environment and also human exposure to that. This is a summary of studies on the risk for brain tumors from mobile phone use and also cordless phone use that was part of our studies. We published in 1999 our first study on that issue, which indicated that there was an increased risk for brain tumors on the same side as the mobile phone had been used, as indicated up to the left with a schedule of the brain and the mobile phone and a marked part of a tumor on that side of the brain. We can see in summary of these three comprehensive studies that have been done that the risk is about 2.5 for a brain tumor on the same side as the phone has been used, which is highly statistically significant. The same was for acoustic nevrinoma, which is a tumor on the hearing nerve. And again, we can see here that on the same side of the brain as the phone has been used, there is almost 3 times significantly increased risk. And we can also see that there is a almost free passage of the radio frequency radiation through the ear into the nerve on that side of the brain. These results were part of the IARC evaluation in 2011 of brain tumor risk associated with radiofrequency radiation that I was part of, and the decision was group 2B at that time. I have more recently done studies on the environmental exposure in contrast to the personal exposure when you use a mobile phone, and these have been done together with Dr. Tarmo Koppel from Tallinn. And here is the situation, picture half a year ago in Stockholm, where we can see these very low placed antennas, and there are many of them in Stockholm. Here is another place in Stockholm, which is the Old Town, and we can see that these base station antennas are very low positions, very close to people who are walking along the street, and also the traffic there, of course. We made also measurements of the radiation in common places in Sweden, like in the Sergel Plaza, which is mid-Stockholm, a very common communication place. And we could see that according to these numbers, the exposure is quite high using the NARDA meter, which is a broadband meter. And we can see that the root square mean level, which is not the peak levels, actually is in the magnitude of 30-40 volts per meter, or some more than 3 million microwatt per square meter. And the similarly in Stockholm Central Station, we can see here these antennas on the roof, and also people that are passing by. And again, we find very high levels, 37 volt per meter as maximum. And of course, the peaks are even lower than that. And these are also localization at a street, Central Street in Stockholm, where the antenna is on a very low position, first floor, and very high exposure, 44 volts per meter, or more than 5 million square meter per microwatt per square meter. We have made measurements, or studying rather, clinical symptoms in people who have contacted us after the 5G base stations have been installed close to their homes or their offices. And these are results are actually under publication in total. As we can see from this slide, the very common symptom is fatigue. I mean, people get tired, and also the most common is difficulty to sleep, with a score of 100 points. 16 persons giving scores from grade 0, that's no problems, until 10, which is the worst symptom. So this is very common among these people. And also there are other early wake up and headache and irritability and so on this scale, which are quite problematic for these people. Many of them had actually to leave their homes, so they have to go to another place, those who had the possibility to do that for economic reasons. But of course, most people do not have that possibility. These are exposure guidelines, ICNIR, which is the International Commission on Non-Ionizing Radiation Protection. 1998 gave the power density of 10 million microwatt per square meter. We have other organizations like the EU Parliament STOA Commission 100, Bioinitiative Report 326, EMF guidelines, European EMF guidelines 0.1 to 100, and now more recently ICNIRP whole body exposure 10 million microwatt per square meter, and local exposure even more higher. So this is the opposite to what the science shows. I mean, we should have prudent avoidance of exposure and go to the international commissions that are that do not have any conflicts of interest, that have give much lower values. And also the science has evolved since 1998 by the animal studies, by human epidemiology, and also mechanistic studies that show how the carcinogenic effects from radiofrequency radiation can occur. So this is a very unusual situation that we have increasing exposure, but the guidelines, the precautionary principle goes into the opposite direction. Obviously, this is not driven by scientists. It seems to be economic interest behind this, which is a problem as to human health and also the environment. Thank you.